Good afternoon. All right, we are just over 1 o'clock, and I like to keep things punctual and respect your time. And anyone else who isn't on this workshop, part one, obviously can reach out to us later and get some information. But welcome all. It is Thursday afternoon for some of us and Thursday morning for others, but let's begin. This is Agent Workshop Part 1, Intro to Medicare and your 2021 updated and changes coming to CMS and for Medicare. So once again, this is John Fallett with Senior Enrollment Solutions. For those of you who I haven't met, welcome aboard. For those of you I do know, welcome back or welcome on. I have allowed a chat room or a Q&A area. I will keep the webinar on 15 minutes or so after 2 o'clock, which is our scheduled end time. Hopefully I can get you off the phone before that, but obviously we have a lot to cover. So any questions, write them down. Email us at Agent Services, myself at John at Senior Enrollment Solutions, Jasmine, Teresa, or anyone else to be able to get your questions answered. So without further ado, let's begin as it is 1:03. And once again, to respect your time as well as punctuality, we're just going to begin. So who is SES? Well, I began this agency in 2005. I implemented one of the first agent CRM platforms in 2006. And at that point in time, it's about $1 million in health insurance. The next year, 2007, 2008, I was about $2 million in health insurance. And I had moved to telephonic sales. I want to repeat this. I have not seen a consumer in 12 years, but I still produce a lot of business. And I'll walk you through that here as the upcoming workshops continue. We automate, streamline, and once again, produce a lot of business just simply in the manner in which we know our telephonic compliance and sales. So the creation of SES. In 2009, the Affordable Care Act was enacted, and I moved from health insurance and life insurance because the commissions frankly got tanked offering health insurance. We moved to Medicare as Medicare, the bubble began, and you are in a perfect time as there is a senior aging into Medicare right now every about 5.5 seconds. So this bubble that has occurred is in your lap. Take advantage of it for the next few years. And obviously the ability to receive true renewal income. I know that we have some life agents on. I see we have some annuity agents on, as well as some health agents on. You know, the beauty with COVID and what has occurred is to really know and feel blessed that this renewal income will continue to come in month after month, regardless if you continue to see or assist consumers. We created SES due to losing renewal book from a previous agency, right? So that's certainly something that we really initially, the first goal, and has always been the goal, is to protect you as the agent. In the event that something occurs with your renewals or what have you, to have those relationships in the marketplace to attempt to get your money back. We are a non-captive agency. We're now in 47 states and 155 plus carriers. We have the FMO, the top contract with most carriers across the United States, and we assist hundreds of agents in growing their Medicare and their life insurance business. So getting into the renewals, the one thing that I absolutely love in regards to this industry, and if anyone wants this, I'd be happy to share it with them or send it over, but I made a very simple Fisher Price My First Excel that walks you through that you're one agent, the average annualized volume of Medicare supplements, how many supplements you write, what the average commission is. Obviously, this is nationwide for you Michigan agents that are balking at this commission level. Average across the nation is about 19%. We know Michigan pays hot and heavy for the first 3 years. Above and beyond that, your MA plans, your commission, how many apps you're writing, what the new commission level is. For those of you that don't know, 2021 is bumping up to 539, excuse me, and 270 for renewals. Your MA commission renewals, and then obviously what your potential earnings are. What really I want to point out is if something occurred in 5 years' time and you were to fall ill, you were to become sick, or something happens within your family, the joy of that renewal income continues to pay for years and years and years to come. And that really can create a life insurance policy, for lack of better words, for your spouse or for your loved ones in the event something does happen to you and you're unable to continue to write business. What it takes to offer Medicare. On the supplemental side, not much. You just need a state health and accident license for whatever state you're looking to produce business in. You need to complete your continued education credits. Those are due here in Michigan biannually. And you need to simply contract and offer coverage through Mutual of Omaha, IAC, whomever it may be. With an Advantage plan, it's a little different, where you also need to have your state health and accident license, continued education, your CE credits remain the same. However, to offer Advantage plans or prescription drug plans, we all know that you need to take that annual AHIP certification. If you haven't taken it yet, know that SES reimburses your AHIP if completed by the end of July. So you don't necessarily have to pay for it as long as you get it done this month. And obviously, above and beyond the AHIP, you would also need to certify with each carrier that you're looking to conduct business with. Now, as a side note to the PNC agents, those property and casualty agents that are currently on, you do not have to take your AHIP to offer United Health, which is a huge perk that you are able to get into United Health, offer Medicare Advantage or Medicare supplemental plans to your consumers without necessarily having to take the AHIP certification or requirements on an annual basis. So now let's get into some Medicare basics for a moment. Let's get into the meat and potatoes. So what is Medicare? Medicare is a federal health insurance program for people, most people over age 65, those people under age 65 that have disability, those with end-stage renal kidney disease, or those with Lou Gehrig's or ALS disease. So typically what we're referring to 99% of the time is a consumer over the age of 65 or a consumer that's under the age of 65 that went through 25 months of disability to now be receiving Social Security disability. So what's covered? Well, Medicare covers your services like your hospital, your doctor's visits, lab testing, surgeries, wheelchairs, walkers, etc. I will go in depth in that further here in a moment. And let's jump into the A, B, C, and D of Medicare. As long as you understand the A, the B, the C, and the D, then everything else will just lay down for you in regards to understanding and coverage or explanation to your consumers. So your Part A. Your Part A is your inpatient hospital room. Just the room. It covers the room and board. It doesn't cover your durable medical equipment, medications taken, surgeon, assistant surgeon, anesthesiologist, etc. It is just the rental of the room itself. It also covers, above and beyond just the room itself, your durable medically, your hospice care, your skilled nursing, and your blood transfusions. My apologies, I'm losing my voice. So your Part A, for people over 65 and under 65 with disability, generally has no cost. You earn the right to have your Part A by working 40 quarters or 10 years, or maybe your spouse worked 40 quarters or 10 years and paid enough into Social Security to earn the right to have your Part A. Currently, for 2020, your Part A has a per occurrence deductible of $1,364. Then you go into an 80-20 coinsurance, means it's a split between what the carrier is willing to provide and what your responsibility is as a consumer. That is per occurrence. So let me step back. You break a hip, you pay the deductible and then 20% of any and all remaining charges. When you go back in 2 weeks later, because you catch pneumonia, which everyone does who breaks a hip, you're responsible for yet another deductible and 20% of that occurrence. The issue with your original Medicare A and B is that it doesn't have a stop loss. There's no maximum out of pocket. So you're paying that 20% until kingdom comes. Once again, hospitalization, hospice, skilled nursing, blood transfusions are the primaries that Part A covers. And you may obtain it once again from your spouse if your spouse had worked or paid into Social Security for a minimum of 10 years. Your Part B premium currently is $144.60 per month. Some consumers pay a little bit more because they earned a higher wage, either prior to retiring or what have you. But nonetheless, it currently is $144.60 for most consumers. There may be a $3 surcharge added on for 2021. Those numbers have not yet been released. So there is a cost to paying the Part B where there isn't a cost to paying the Part A. That's generally automatically withdrawn or deducted out of your Social Security check. So with your Part B, there's an annual deductible, currently $198. When and if you satisfy that annual deductible, you pay 20%. Medicare pays 80%, once again, until Kingdom Comes. So it's concerning on the Part B when you start bringing in surgeon, anesthesiologists, some of these expensive cancer treatments, Remicades, et cetera, that 20% can crush a consumer without having a maximum out of pocket or a stop loss. There is a late enrollment penalty if your consumer chooses not to obtain Part B, which is very rare, or if they are part of a union and they don't recognize that by being part of the painters union or being part of another union, they don't have credible coverage. Note to self, the Teamsters do not offer credible coverage. So in most states, you would sign up for your Part B once you are eligible to avoid that late enrollment penalty. So what does Part B cover? Covers your home health services, your clinical lab services, your blood work, your testings, your outpatient hospital services, et cetera, et cetera. And the reality is, it's easiest to understand what Part B doesn't cover. So once again, you're paying $144.60 a month out of your Social Security check to have Part B. Part B does not cover the majority of your dental, vision, hearing, and prescription drugs. So dental, vision, hearing, and prescriptions are really a luxury to Medicare, and they're not covered on the health side of your Medicare. Your annual deductible is $198 with a 20% coinsurance that never ends. And it is an open network, meaning that you can go to any doctor, any hospital that accepts your red, white, and blue card. They'll accept your original Medicare card and there's no questions asked. So when someone turns or is turning 65 or once again receives 2 years of Social Security full disability, they will be eligible to enroll into Medicare. And at that point in time, they would be paying a monthly premium. We'll get back into the premium further in depth here in a moment, but there is a premium to the Part B of your Medicare. Let's jump to Part D for just a moment. Part D is your prescription drugs. D stands for drugs. With your prescription drug plan, it would be a separate entity, and you can purchase this in one of 3 ways. You can either purchase it by joining an Advantage plan, joining a Medicare cost plan, or joining a standalone prescription drug only plan. There is a late enrollment penalty associated with your prescription drug coverage. The easiest way I explain it to the consumer is this. It's 1% of the national average of your prescription drug costs, which currently is $33.80. Your penalty is 1% of $33.80 a month, which ends up being about 34 cents a month. If you go 1 year without having a prescription drug plan at 34 cents a month, it totals about $5 by the end of the year. When you break that down, if you go 1 year, Bill, without purchasing your prescription drug coverage and you decide to purchase it at the age of 66, for simple math's sake, your penalty is roughly $50 per year for every year you choose not to have a prescription drug plan. So if you go 5 years without a prescription drug plan, your penalty then would be $250 a year, broken down monthly, every year thereafter for the rest of your life. So oftentimes it's advantageous to help a consumer either with a zero premiumed Advantage plan or the least expensive prescription drug plan if they don't take any medications, and treat it like a Band-Aid to stop the bleeding of the penalty that they may incur down the road. Your prescription drug coverage, obviously the US government mandates all Medicare Advantage as well as standalone prescription drugs plans themselves. They do or may require prior authorization, limit quantities, and require a step therapy. Don't let those terms confuse or concern you. The prior authorization is letting your physician know that this consumer is on this medication. And if it's not covered on the formulary, requesting it to be covered on the formulary or requesting that the primary care right into the prescription drug provider to authorize this medication use. The limit quantities, the government sets a limit to help abuse, fraud, waste in regards to prescription drugs. So if Joyce is very heavy set and on a lot of cholesterol medications, the government may want to talk to the primary care physician or the prescription drug carrier, obviously regulated by CMS, would reach out to the primary care to say, why are you providing Joyce twice the amount of Lipitor as what we agree that a consumer should have? And then the primary care would say, well, look, we're just trying to get her cholesterol under control. This is what we're trying to do, and balancing out her meds or what have you, and then the carrier would approve it. They require step therapy. Step therapy is trying to keep the costs down for everyone. If Lipitor comes in a generic, which is atorvastatin, they want you to try the atorvastatin first. It's a generic, it saves everyone money. However, if that atorvastatin, for example, gives you leg cramps or has side effects, which some medications do, and you're unable to take the generic, that's where your primary care would reach out to the prescription drug provider, and they do this on a daily basis, and they let them know, hey, look, we tried atorvastatin 3 years ago. The consumer couldn't use it. I need you to approve them for Lipitor. And then the pharmaceutical company would come back and say, yep, I see that you've already tried this. It didn't work, and the consumer needs to be on a name brand medication. So that's what the prior authorization, limit quantities, and require step therapy mean when we're discussing anything pertaining to prescription drug plans, whether it's Part D or a Medicare Advantage. Oops. Next, deductible. Currently, there is a deductible on some plans. It's $445. Your initial coverage limit is currently $41.30. Your out-of-pocket threshold is $65.50. And then if a consumer goes into the catastrophic coverage, then they're paying $3.70 or up to $9.20. Typically, it's a 15% in regards, or excuse me, 5% in regards to the CMS copayments. Additional coverage. Medicare, obviously, as we know by now, doesn't cover everything. There's a lot of gaps, and that deductible and that unlimited 20%. Basically, if a consumer is running around with straight Medicare, they really don't have much coverage at all. So there's 4 ways of filling in the Part A and the Part B of your Medicare. You can either purchase a Medicare supplemental plan. You can purchase a Medicare Advantage plan. You can have it through your retirement plan if you're a union or a blue GM, Ford, Chrysler, hourly employee, part of the union, etc., or you can earn it by being part of the VA. So many different ways of obtaining your coverage, and this is all pertaining to the Part C, which I'll circle back with in a moment. We went through the A, hospitalization, the B, everything else, excluding dental, vision, hearing, and prescriptions. We went through the standalone prescription, and now getting back into the Part C as a whole, the additional coverage. So your Medicare supplement, typically speaking, when you purchase a Medicare supplemental plan, you're going to have larger monthly costs, fewer, if any, out-of-pocket expenses. You would need to purchase a standalone prescription drug plan, meaning you may have your supplement through HAP and your prescription drug plan through Cigna, or your supplement through Mutual of Omaha and your prescription drug plan through Humana. Oftentimes, they are not the same entity. You can go to any doctor, any hospital, as long as they accept that red, white, and blue Medicare card. By you purchasing a Medicare supplemental plan, you have the freedom and the luxury to go anywhere you want, including foreign travel, with little to no out-of-pocket costs. That's why you're paying a premium to have that plan. With a Medicare Advantage plan, you're trading in those premiums for a lower or no cost plan. But just like health insurance, all Advantage plans have copayments, deductibles, and a maximum out of pocket that is currently set by the government at $6,700. Most of these Advantage plans include prescription drugs, so it's all in one plan. And obviously, you would have a network. You would be in a PPO or an HMO network, where if you left the network, you would either be penalized Or you may simply not have any coverage because you're on an HMO plan or what have you, and you left that Humana network or you left Blue Cross Blue Shield's network. With Medigap policies, it works in conjunction with your Medicare benefits. So sometimes I get consumer calls saying they don't accept Manhattan Life, but they accept Medicare. Oftentimes, the doctor's offices, because you are once again in this giant bubble of Medicare consumers aging in, all these life carriers are going after the Medicare now. So as Lumico, CSI, CSO, Manhattan Life, Great Western, et cetera, all get into the Medicare supplemental world, they're doing so obviously because of the revenue that can come out of it. But nonetheless, the doctor's office may not know who this carrier is. So it's important if your consumer does have a Medicare supplemental plan to really load their lips when they're going in to make a doctor's appointment to make sure that, yes, we do accept original Medicare. And at that point in time, it doesn't matter what med sup plan you're on because they're all accepted by any doctor or hospital that accepts your original red, white, and blue Medicare. You must obviously keep your A and B to purchase the plan. You pay a monthly premium in addition to your Part B. Obviously, it helps with your out-of-pocket costs of original Medicare. They're offered by private insurance companies. They're all standardized and they're all guaranteed renewable, meaning as long as you pay your monthly premiums, they can't cancel your policy. So here are your current Medicare Medigap plans, your Medicare supplemental plans, potato. They are all standardized once again. So a Plan F is a Plan F. It doesn't matter the carrier. What we're after is which carrier has the best track record in regards to rate increases and the lowest monthly premium. That's the plan that you're going to want to purchase. Plan F and C have both gone away for new consumers aging into Medicare after January 1st, 2020. Older consumers that may be 67, 68, and are deciding to retire from General Motors at this time, they can still purchase a C or an F or any of the other plans that are listed above. Right now, the two plans you should be focusing on as an agent are G like George and C like Charlie, or D like David, depending on the state that you're in. Certain states like Ohio do not charge out-of-pocket or excess charges. So obviously D is certainly more prevalent in certain states than in others. But all of them are standardized. Exactly the same coverage, just slightly different premiums. And obviously on a business side, if Mutual of Omaha had the best rates across the nation, we all understand it would be a monopoly. And to help keep that monopoly down, that's where Mutual of Omaha may have amazing rates in North Carolina, Tennessee, Texas, et cetera. But United Health is really the dominating force in Delaware and a few other states. And so that's how there's really never the thought of a monopoly occurring when it comes to the Medicare supplement. Just so we're all on the same page, Medicare supplemental plans, Medigap policies, they do not include long-term care, vision, dental, private duty nursing, prescription drugs, hearing aids. Those are all luxuries above and beyond the health or having your health be covered in full. When running rates, you can always just go right to the SES agent portal, onto the tools. From the tools area, you would just simply enter the zip code, the age, the sex, or gender of the consumer, if they have a household discount, and then you just run your rates. You may need to toggle the monthly rates to get them in order. This is obviously here in Waterford, Michigan, with a 65-year-old female with a household discount that you can see United Health is at 108, Priority Health at 111, HAPS at 113. Now, there are a few nuances to some of these plans, which we can either go into now, which I believe I have time since I'm about 15 slides out. So, notes to self. Mutual of Omaha offers iMed. It's nothing to write home about. It is a vision discount plan that's embedded into their Medicare supplemental policies. You get your eye examination at $40. And then your eyewear is a 40% off, lenses, frames, etc. So Mutual of Omaha offers iMed. Pekin offers a gym membership through Silver and Fit. Several others offer the gym membership here in Michigan through Silver and Fit as well. HAP is offering a Delta Dental buy-up for 2021 for those of you who have not certified thus far. So Health Alliance plan is really crushing it right now here locally because of the rates as well as that Delta Dental buy-up. Excuse me. So there's your Medicare supplement quoting engine. So hopefully we all understand your Medicare supplement or Medigap options. You're paying a monthly premium to have the ability to go to any doctor, any hospital, no referrals, no questions asked, and you're covered at or darn near 100% for that coverage that you're obtaining or receiving from that specialist or that facility. Your Part C continued. Your other option is to purchase a Medicare Advantage plan. With a Medicare Advantage plan that is governed by CMS, it's regulated by the Centers for Medicare and Medicaid Services. They must cover all services original Medicare covers. So they're not going to not cover something that Medicare would cover, like an infusion or something of that nature. You have one insurance card typically. Your prescription drugs and your health would all be on one Humana card or one Blue Cross Blue Shield card. They're private companies who cover your A and your B and include, once again, most of the time, your prescription drug coverage, and obviously you have to stay in network. So with a Medicare Advantage plan, what you're doing is you're assigning your A and B to a private insurance company, a company that's more efficient in handling your claims, processing your bills, etc., from original Medicare. And in turn, since Medicare is no longer dealing with your Part A and Part B of Medicare, they wash their hands, they part as friends with you, and they assign all of this to Humana, Aetna, United Health, or whomever it may be. And in turn, that's how you're able to purchase a zero premium advantage plan or a no cost advantage plan, because once again, it's being subsidized by the federal government. Now, most of these plans will offer not only prescription drugs, but the luxuries of Medicare: dental, vision, hearing, gym memberships, transportation, over the counter benefits are oftentimes included. So if someone is not a dual eligible, which I'll touch base on here in a moment, they may be penny wise and pound foolish in buying a Medicare Advantage plan, frankly, due to the fact that they may be healthy now, but 2 or 3 years from now, maybe they have a stroke and they're coming up with $6,700, $100 in out-of-pocket costs, or maybe they just bought the plan just to get some dental. And if that's the case, then obviously we're being short-sighted in regards to your health. So just be aware and understand how to explain why an Advantage plan doesn't have a monthly premium. And it's because you're assigning that coverage to a private insurance carrier who in turn gets reimbursed by the federal government. And that's how you can purchase a no cost or a zero premiumed plan. Continued. You must have or keep your A and B. You're going to continue paying that $144.60 every month for the Part B. You must live in the service area. You must be in the county in which that plan is offering coverage. You don't have end-stage renal kidney disease. Now, side note, that is not going to be a question any longer on 2021. So for those of you who have not taken your AHIP or certifications yet, hopefully this will help you pass that. Yes, if you have end-stage renal kidney disease, you may be accepted for coverage effective January 1st, 2021. You are a U.S. citizen or lawfully present. They want to know that obviously you've paid into Part B and that you're remaining in the United States at least 6 months out of the year. For most consumers, they can change their plan from October 15th to December 7th unless they have a special election period, which I will go into here in just a moment with you. This is the meat of the season. It's the annual enrollment period where you can begin discussing coverage with consumers effective October 1st. You cannot accept an application, you cannot hold an application, but you can get your consumers prepared to sign the application or mail it out on the 13th to them or whatever necessary to get them lined up. So as of October 15th, you're submitting business and getting your current book taken care of because at that point in time, the only thing your current book has to share with others is how amazing you are and to refer you other consumers out. As of December 7th, midnight, your time zone is when you are able to send in or submit the last application, unless it's mailed to you and you have a postmark, and obviously then you can generally push it through the 8th, but typically they're pretty hard nosed that everything gets down by the 7th. Different types of Medicare Advantage plans. You have your HMOs, your health maintenance organization, where typically they require referral most of the time. Your PPO, which is going to have a larger network and not require referrals. Your special needs plans are either for those that are on Medicaid and Medicare, or for those that have a chronic illness and have a chronic illness plan available in their area, either diabetes, heart disease, or something similar. And the private fee for service, which I'd ask of you to stay away from, is referred to as a PFFS, which doesn't have a network, but every time you schedule an appointment to see a physician or a specialist, you have to make sure that they're accepting your plan's terms and conditions still. So let's talk about the HMO and the PPO very briefly. Most of these HMOs on Medicare are not requiring referrals any longer. You would still have a primary care physician. You would still need to see that primary care physician. But if you wish to go see a specialist, a referral is no longer required on most of these plans. With HMO Advantage plans, they are generally going to have less risk, less out-of-pocket costs, lower deductibles, lower co-payments, what have you, compared to the PPO plans. Because you're trading the luxury or convenience to be able to not have a referral, to be able to have a larger network of physicians, etc., you are giving up those value-added benefits. The dental, the vision, the hearing, the transportation, the over-the-counter benefits will be less. Your risk will be higher. Typically, your premium will be higher as well because you chose to have this PPO-style plan. Hopefully that makes sense. With your Part C, your Medicare Advantage plans, once again, you may not have a monthly premium. They are in addition to the premium you're already currently paying on the Part B. You obviously may have deductibles, co-payments, and co-insurance, and a maximum out of pocket up to $6,700 potentially a year. They may not pay for services that are out of network, once again, if you're on an HMO or you're out of country, what have you. And the special needs plans obviously coordinate benefits with Medicaid, which I'll touch base on here in a moment's time. Helping customers and receiving referrals. One way that I obtain most of my referrals is helping consumers lower their cost and providing them a better value. With the extra help that's provided through Social Security, I refer to it as LIS. That's what we refer to in the industry, low income subsidy. Social Security refers to it as extra help with your prescription drugs. Write these numbers down. It's incredibly important that if you're around $19,000 a year as an individual or around $25,000 a year as a couple, not to get too personal with you, but out of curiosity, do you make more than $19,000 a year? Oh yeah, I make way more than that. Okay, great. Good for you, right? I mean, I just want to ask just to see if I can obtain or help you lower your overall costs and obtain better coverage. So what is extra help? What is LIS? LIS or extra help is through Social Security once again. A couple things that they will assist with. One, on the prescription drug side, they remove the donut hole. They remove the coverage gap. Two, they remove the late enrollment penalty. Three, they pay a portion or all of your prescription drug premium, up to around $33.80 a month, the average of what a prescription drug plan costs. Or if you find an Advantage plan that has a $30 prescription drug cost and the entire Advantage plan is $30, then obviously then the consumer wouldn't have to pay anything for their prescription drug plan because the premium is weighted on the prescription drug side, which then Social Security would cover. It provides fixed copayment costs on your medications. So currently, you would not be spending more than, I believe it's $3.95 for a generic or $9.85 for a name brand medication, period. So they know that this insulin, which is a huge topic, on the news, etc., is not going to cost me $150 anymore. The most I'm ever going to pay for it is $9.85. They can switch their plan quarterly throughout the year, the first 3 quarters of the year. Otherwise, they would fall into the annual enrollment period. So with that special election, it allows for them to jump plans. And the reason is these prescription drug providers can opt out of covering Lipitor, as I brought it up earlier. In May 2014, a carrier decided not to cover Lipitor anymore. And it left a lot of people paying cash or trying to deal with taking a generic. What Social Security allows with the extra help is if for whatever reason your carrier is no longer covering that medication, it allows for you to get out of that plan into another plan within that quarter. So that way, maybe you're moving from Humana to Aetna or Aetna to Blue Cross, what have you, but it allows for you to make sure that that medication still remains covered on your plan. Lastly, which isn't on the slide, the Social Security LIS will also pay a portion or all of your Part B premium. So if I'm meeting with a consumer, telephonically, of course, and that consumer says, wow, I really want a Medicare supplemental plan, but gosh, I only make $1,400 a month. I don't know if I can squeeze it in my budget. That's fine. Let's apply for extra help. Let's see if you qualify. And if you qualify, now I just saved you $144 a month on your Part B. I also saved you $33 a month on your prescription drug plan. I also just lowered or provided you fixed costs on all of your medications. There is no way you can tell me that you don't have money for a hospital indemnity plan, a final expense policy, or a Medicare supplemental plan. I just freed up thousands of dollars a year for you. And once again, this is how I receive a tremendous amount of referrals because so many consumers receive the application from Social Security and they frankly never fill it out. They have no idea what this program is or how it could help them. I come in and I save you $2,500 a year. You're going to scream my name like wildfire to all your friends and family. It's a beautiful tool to use as an agent in obtaining additional referrals. How do you enroll in Social Security Extra Help? You can phone them. You can apply right online at the ssa.gov website. We do have the application in paper form if you'd like it or need it as well, but super simple to go on and apply for coverage. Obviously, there's the specific link, which is the I-1020. I would just suggest that you go to ssa.gov and apply for extra help. To review, this is what I send out to my consumers. And I send this out to all consumers that I talk to on the phone. And I thought it was important just to kind of recap and go through prior to ending this webinar with all of you to really understand and maybe see it in a different perspective. You have 2 ways to obtain your Medicare. Option 1, you purchase a Medicare supplemental plan and a prescription drug plan. Your Part A, once again, no cost. Your Part B is $144.60. The average Medicare supplemental plan, call it $123. You receive 100% coverage or darn near close for medical or hospital expenses. No networks, any doctor, any hospital, guaranteed renewable, and your prescription drug plan will cost about $20 a month. So as a consumer, you can see that you need to set aside about $288 a month to have a Medicare supplement and prescription drug plan, excluding any dental, vision, hearing, or additional long-term care, accident coverage, critical illness, what have you, or co-payments on the prescription drug plan itself, right? I don't know what medications you're on. I'm not going to include that. Your other option is to purchase a Medicare Advantage plan. With your Part A, no cost. Part B, still the same. With your Part C, once again, you're purchasing coverage through a private company contracted with Medicare to provide you all your hospitalization, A and B, and your prescription drug coverage all rolled into one private plan. They do provide luxuries like dental, vision, hearing, transportation, etc. HMO or PPO network based, little to no monthly premium. You are typically on a calendar year contract, right? You can only change during the annual enrollment period. So your new coverage would begin January 1st if you exhausted all of your dental, or you didn't like your plan, or your doctor retired and you need to go to a different primary care that accepts a different provider, what have you. Typically, unless you have a special election period, you can only enroll or re-enroll once a year. Your out-of-pocket costs, once again, average between $4,200 and $6,700 a year. And your total cost, once again, is just your Part B premium. So as a kind of a breakdown for consumers, I do send this out. There's nothing non-compliant about this. I don't go into specifics in regards to plans or carriers, what have you. And this is a great breakdown for a consumer to really see, oh, I get it now. I only have two options. There's only two. Once you decide whether or not you can afford or wish to have a supplemental plan, or once you decide that you wish to have a Medicare Advantage plan, then everything else lays down very, very easily. But that initial question has to come about with the consumer. And once again, with the low income subsidy, that is certainly something that I hit on very hard just to see if I can help you save any money. And frankly, I do want that referral from you moving forward, right? If I can save you a few $1,000s, I pretty much expect a referral, as no one else is really doing that for you. Next, your main contacts here at SES. Obviously, these are the people in which you phone in and most likely talk to. I'm obviously the principal of Senior Enrollment Solutions. Teresa Rogers handles our agent services, our life insurance and annuity business. Jasmine Leopold is our contracting coordinator. Angela Schwartz handles all of our enrollments, the scrubbing and processing of all of your paper applications, or any issues that come about with a carrier not receiving or not processing that application for you, as well as the compliance. Ellie Phillips is our internal Medicare specialist. She knows more about union coverage and more about just kind of the wonky situations that you may run into in life. Obviously, all of our staff are licensed. We are all very experienced, and we are open 24/7 to assist you. So I understand, as an agent, when I was at a kitchen table at 6 o'clock at night and I'm trying to close someone and they have a weird question I couldn't answer or didn't have the knowledge at that time to answer, no one was ever open to allow for me to obtain that answer to close the consumer at that time. So understand that SES is 24/7, literally, for you. So if it is 8 o'clock at night or 9 o'clock at night, or let's say that you're West Coast, which some of you are, we are open 24/7. So it doesn't matter if it's midnight East Coast time and 8 o'clock your time. We understand that you're still producing business and that you still may need some assistance in closing that consumer. Reminder, the next SES Educational Webinars Part 2 is on August 28th, same time, same place. Hopefully the comfy sofa in which you're sitting on at this time. We're going to be discussing marketing through COVID-19. I know a lot of agents are doing an amazing job learning telephonic skills, enrolling people over the phone. Very few paper applications have come in over the last 90 days, even though we are actually up 13% revenue as opposed, or production count, call it what you will, as opposed to last year at this time. So we need to really understand how to compliantly write these consumers. Who has the telephonic signatures? How do you write whatever carrier online? And I will break that all down, and more importantly, discuss how we continue to market ourselves through this period of time when consumers may not really have their doors open in visiting with you. And I do know that that's a concern. We have lots of Walmart stores, we have lots of Kroger stores, et cetera. And I'm working with these carriers, and we're actually creating PPE to put into these stores to help protect the agents. But nonetheless, it is far more convenient to be able to just work from home and to be able to continue producing business. At this point in time, This makes it a little difficult, but we did set up a prize wheel. I know on a few of the other webinars that we've had, we spun the wheel, we've given out prizes. I know a few of you on the call have received unknowingly because the last call we had with HAP, we did door prizes as well, but we had an issue on the security with HAP and being able to share screens. So we do have a wheel that I do have a list of everyone's attendance. Your names are in a hat, and frankly, we're just going to spin the wheel. This is a picture, obviously. The wheel itself is right here. So we're going to spin a wheel, and we'll let you know, hopefully, if you won a mailer drop or an iPad or whatever the case may be. So unfortunately, I can't provide access to you to be able to spin the wheel yourself, but I will let you know if you have won a door prize or hopefully a mailer drop or an iPad at this point in time. I will let you know I have had iPads on order for 9 weeks now. They're very difficult to come by. So if you do win an iPad, I will let you know. And as soon as they come in, I will get it in your hands. But unfortunately, due to everything being on a shortage, there's very little of them to go around. And obviously, I don't want to purchase a refurbished or a used iPad for you. We're a little beyond that. So anyway, thank you all for attending. I know I was able to make this through prior to an hour's time. If you have any questions, you're more than welcome to text us anytime, Skype us anytime, email us or phone us. We are open. So let's pause here for just a moment. The Waterford office does have a drive-through. We are marketing currently, especially with AEP coming, to really push consumers as well as agents to go through the drive-through. If you need applications, we're still offering the 24-hour courier service. You let us know today by 4 o'clock you need applications in hand. You wake up tomorrow morning, they're on your front porch. So we're still couriering applications to agents. We'll still mail out apps, or if you need something from us, we can always leave it in the vestibule in the front of the office. But we are keeping the amount of activity, the amount of walk-in consumers, as well as agents at an absolute minimal at this point in time, as we're all kind of unknown with what is occurring with this global pandemic. So not to push you out of the office, we just want to love you from a distance. So we are offering a slew of avenues that you could just stay in the comfort of your own car, jamming out the radio, and we'd be happy to scrub any paper applications that you have. However, once again, if you are looking to come into the office doors are technically open on Tuesdays and Thursdays for appointments only. If one of you wants to come in and sit down with myself or Teresa or go through contracting or questions, what have you, you're more than welcome to. But obviously, with everything that's going on, our first step is to protect you as the agent. The next is to protect, obviously, the staff that's supporting you. And to have our entire staff go down for the month of October just doesn't sit well during the busiest time of the year. So we are taking whatever precautions we can to keep the staff here safe, to keep you safe, and hopefully your family safe at this point in time as well. If you need anything, you're more than welcome to begin your chat session or your questions. You're more than welcome to phone us. At this point in time, I'm going to end my screen sharing with you. So you may just receive actually just a thank you page or a black screen, but I will remain on the webinar here for the next few minutes. So if any of you have any specific questions, if you need anything in writing, anything that I've shown you, once again, this webinar is recorded, so would be happy to share it with you if you have any further questions or just wish to review it. So once again, this is John. It is July 30th. I thank you all for your time. And hopefully we're all able to gain something out of this webinar, and hopefully we're able to see you on this upcoming webinar here in August. Enjoy your afternoon, stay home, and stay safe.